Hi, I'm Dr. Joe Nyam to LoveThatFace.com, and thank you for watching. If you follow our video channel, you know that I'm a cosmetic facial surgeon in Richmond, Virginia, and that my passion is facelift surgery. We have many videos and almost 20 million views on our videos regarding facelift surgery and other cosmetic surgery procedures such as eyelid surgery, facial implants, lasers, brow lifts, that sort of thing. And I spend a lot of time talking to YouTube viewers about various topics. I get a lot of questions. And one question that pops up frequently is, do I need to lose weight before I have a facelift? Okay? And that's a great question because there are a lot of variables. Now, the bottom line, the answer to this is it depends how much fat you have in your face. All right? There are a lot of people that are that may be overweight or have a high BMI, and they're carrying fat in their belly, in their thighs, in their butt, but they really don't have that much fat in their face. And they can be significantly overweight or have a lot of excess body fat, but not have that much in their face. So for that patient, it really doesn't matter. Now, there are patients that are the opposite, or that they have a lot of body fat, but they have a whole lot of fat in their head and neck. And that's a little bit different story. Now, I have a video out there, a very popular video on the management of fat in facelift surgery, and I talk about how we liposuction fat and remove fat. That's a big part of facelift surgery on anybody, because anybody that's old enough for a facelift is going to have some fat that needs to be managed. So we do liposuction, we do buccal fat reduction, we actually cut out some of the fat. So when we take out fat during facelift surgery, that's a permanent reduction. That fat can't come back because we remove those fat cells. Now, that doesn't mean that you can't make new fat, but that removal is permanent. So again, if you're carrying a lot of fat in your face, now, for instance, I do a good bit of patients that have massive weight loss. They'll have some weight loss abdominal procedure, stomach procedure, stapling, ring, whatever. And, you know, they'll lose 150 pounds, okay? So somebody that's going to do that, then yes, I would have them wait till after their weight loss before performing surgery. And I'll show you some pictures that I've done on patients that have had massive weight loss post-bariatric surgery patients. And then that becomes, instead of managing a lot of fat, it becomes managing a lot of skin. So, you know, the average patient that walks in here, I mean, let's face it, all of us would probably love to lose 10 pounds, but, you know, there are patients that are 10, 20, 30 pounds overweight. Most of those people are candidates for facelift as they are. And, you know, losing 10 or 20 pounds is not going to make that much difference because we're going to sculpt that fat. So again, if somebody comes in, they say, I want to lose 20 pounds before my facelift, does that make a big difference? I'm probably going to say it doesn't. If somebody comes in and says, I'm going to lose 150 pounds before my facelift, then that probably does. Another thing that I do, if you watch my videos, you know that I'm frequently lying patients back, because when you lay back and raise your neck, if you're totally flat, that kind of gravity takes over, and that kind of gives you an idea what you'd look like with a facelift, right? So a lot of patients think that they have fat and it's really skin, and then some people think it's skin and it's really fat. But if you lay back and things look pretty good, all right, then that means your excess is probably a skin excess. If you lay flat and look in a mirror and nothing changes, then that probably means that a lot of that is fat. So there's really no straight answer for it. I can tell you this, I've had patients come into my office that went to some other cosmetic provider and they told them they had to lose 50 pounds or 80 pounds before facelift surgery. And I operated on those patients and got some of the best results that I've ever had. Now, you know, it's not healthy being overweight. We know that, and it complicates health, it complicates blood pressure, it complicates anesthesia. So, but the real answer to the question is, if you have a 10, 20, 30 pound weight excess, it's probably not going to make a difference to have your facelift now. If you have something that's really big, then you have to wait. And obviously, you know, this is not a succinct formula for everybody. I have to look at people and do a physical exam. But I just wanted to give you the skinny on fat, okay? And I appreciate your watching. I'm Dr. Joe Nyam to LoveThatFace.com.
So we're going to be talking about do you really need to lose weight before you have a facelift? And from the previous video, you see that basically if you're not carrying a lot of fat in your face, then you probably don't need a significant weight loss. Now we all carry some fat in our face, and if you look at these pictures, the pictures on the left shows the kind of fatty area that we see on the average patient that is under their chin, the submental fat. And this is the superficial fat that's close to the skin. Now, there's also a deeper fat pocket that you see in the middle picture, and on some patients we'll reduce that. And on the right-hand picture, I have outlined in yellow kind of the average area of fat deposition on the average patient. Now, some people have thin bodies and they carry fat in their face. Other people have higher body mass index and they have a thin face, and some people have a thicker body and thicker face. So everyone is a little different. Now, when we are doing any facelift, whether it's on a thin patient or a heavier patient, liposuction is very important, and we're removing any unwanted fat. And as I also mentioned, this is a permanent removal. In other words, these fat cells won't grow back. So this is one of our um, uh, kind of tricks in our bag of tricks to reduce facial fat at the time of facelift surgery. Now, here is a view under the facelift flap. So obviously this patient's asleep and the flap is open. And another thing that we do is what I call open liposuction, where we are um, sculpting. It's actually liposculpture, and we're sculpting the fat on the cheeks and the jawline and in the neck, so we can make this a more youthful transition and thin this fat out to give a more youthful result with our facelift. And we also I do what I call terraced liposuction. So you don't want to remove all the fat because that just won't look natural. So what we do is that we reduce this fat in stages and in a terrace, because fat is really our friend and we don't want to just remove it all. We want to sculpt it. Also, another trick is to reduce the buccal fat pad, and this is the cheek fat that we can remove from inside the mouth or sometimes through the facelift flap. And this also helps us sculpt the face. So I'm talking about, do you need to lose weight? Well, if, somebody has a 15-pound, 20-pound weight excess, they probably don't need to. I will tell you about bigger weight loss in a second. Now, some of our patients, they have a high uh, BMI. Okay, these are patients that are just heavier and they're bigger people. A lot of times this has to do with heredity, and if these patients are going to have surgery or if they're going to lose 80 or 100 pounds, then it's probably a good idea to do the facelift last. However, even on some of these patients, I've had very good results adhering to the fat reduction principles that I showed you in the previous slides. Now, one thing about patients that have either they have a excessive amount of fat in their face or they have lost 100 pounds, these patients have a lot of excess skin. So it's going to be a bigger facelift and a little bit more work on my part, but their result is going to be very good in the end. So I want to thank these patients for letting me use their pictures. And here's a patient that lost almost 150 pounds after bariatric surgery. So it would not have been smart to do a facelift on this patient before her weight loss. So this is a good example of a patient that should lose their weight first. And you can see the patient pointing to her before picture, and that before picture is after 150-pound weight loss. And then, of course, the patient shown here pointing is after her facelift. So there's a lot of different variability that goes into, do you need to lose weight before you have a facelift? And this is the before and after. And again, remember now, the before is after 150-pound weight loss. So obviously a pretty nice result and very happy patient. Now, here's a patient that um, has a high uh, BMI, and but really wasn't carrying so much fat in her face. It was mostly skin. And again, these patients are good friends, and I really appreciate them allowing me to use their pictures. But you can see what a nice result we have because we're dealing with more skin here than we are fat. Same situation here. Okay, here's a patient that she was told that she needed to lose weight before a procedure by another surgeon, but I did not feel that she was carrying that much fat in her face, and we proceeded with her facelift with an extremely uh, satisfying result for me, the surgeon, as well as the patient. Here's another patient, and again, this is you look at these pictures and you remember these patients. This is such a happy and friendly patient, and she just told me, "Hey, Dr. Joe, this is my body type, and I want to do a facelift." And um, so again, she had relative adipose tissue in her neck, but not that much in her face, and we were able to do a facelift without any major weight loss. Another patient. So all of these situations, all of these situations depend on how much fat you have in your face relative to your body. And patients that have mostly skin and less fat obviously do much better. And patients that have really, really excessive fat in their face need to lose weight before their surgery. So I hope I've answered this question, and let me just quickly summarize it. Do you need to lose weight before you have a facelift? And again, I'll say if you're somewhere 10, 20, 25 pounds overweight, you're probably not carrying enough fat in your face to make a big difference. And many, many, many patients that I see in that situation have facelifts, and we use the principles that I showed to reduce that facial fat and have great results. And for the patients that have 80, 100, or 100 plus pounds overweight, then most of those patients are going to need to lose their weight first and have their facelift, and then that is going to be dealing with primarily skin. So stick around 1 second. I'll show you some more before and after results.